I'm going to supplement a little bit more with the previous precautions when a beginner does FNA video. The syringe is composed of an outer barrel and an inner plunger. Before FNA, if you go back and forth several times between a barrel and a plunger, which relieve the pressure between the two, FNA can be easier. When you are flushing a specimen from the needle hub to a bottle after FNA, make sure to hold the connection area between a needle and syringe and proceed with it in a fixed state. Sometimes the specimen on the hub is quite sticky, and if you apply strong pressure when flushing, the needle and syringe may separate. The specimen on the hub may splash around. It may splash on the examiner, assistant, or patient. So it is recommended to make it a habit to flush by fixing the connection area between a needle and syringe. A middle-aged woman was diagnosed with benign after FNA from an outside clinic because she had a palpable lesion. She tried to remove the fluid at the time of FNA, but it was too sticky and failed. This lesion got bigger, and she came to my hospital 4 months later. Compared to the previous image, the amount of internal fluid was increased a little more. I removed the 9 cc very sticky fluid using a 17-gauge needle. I'll show you a very sticky sample. You have to push it under quite high pressure to get the sample. In this case, especially fixing the connection area between the needle and syringe is essential. After removing the 9 cc fluid, the size of the nodule decreased, and the patient was satisfied. My thyroid ultrasound clinic has a separate medical waste container for throwing away sharp needles. It is important that no one gets hurt during the examination. This includes doctors, assistants, patients, and employees who throw away the wastes. The physicians who performed procedures should separate the needle using a dedicated container, instead of separating it from the syringe by their hand, as shown. Please dispose of the biopsy needle straight in this big container. For an RF needle with a long line, cut the line and discard only the needle in the medical waste container. After throwing the needle immediately into the container, the doctor should check to ensure that no needles remain, so that the staff handling the medical waste are not hurt. Please empty the needle waste receptacle no more than 70% of the time to avoid overflow and potential injury. The slides can break during slide smearing, however, this is extremely unlikely. It is a regulation to discard broken slides. However, if it is impossible to get samples again, you should clearly label the precautions, so that everyone is aware of not only the ultrasound room staff handling the slides but also the pathology team. Thank you.